name is Hannah Ray, and I'm in nursing 1119. Hey, my name's Hannah. I'm going to be your student nurse today. I'm just going to perform hand hygiene and provide some privacy. I reviewed your chart and your allergies and the doctor's orders and vital signs. So I have a good baseline there. The doctor has ordered me to insert an NG tube today, so that's what we'll be doing. I know you've had this procedure done before, so you know that if anytime you're feeling any pain, have too much to air, just raise your hand for me. And if my patient were to get cyanotic at any time, I will be sure to stop immediately. And we're just gonna, can I get you to state your name and date of birth for me? Okay, perfect. I'm just gonna raise the bed up to a comfortable working height. Just in my half hour's position. Okay. And then I am just gonna check her air for any abnormalities or any blockages. Looks good there. Just gonna test her gag reflex. Everything's good there. Okay. I'm gonna put this towel over you. Perfect. Okay. And then I'm going to also hand you this water because every time I push the tube up some more, I'm going to get you to take a sip and swallow for me. Okay, I'm going to put on some clean gloves. Okay, and I'm just going to measure real quick from the tip of your nose to the ear, from the ear to the sternum, which is about 40 centimeters. So I put a piece of tape around the 40 centimeter spot so I know where to stop. Okay, and I would lubricate the thing. And then, okay, every time I push this up, I'm going to get you to swallow and, or take a sip of water and swallow for me, okay? Okay, we're just going to start going in and going in. We're going to be rotating. Being sure to tell her to take a sip of water and swallow for me. And if our tube would be used for feeding or anything like that, we would have to get an x-ray to confirm placement before the feeding. Almost there. Okay, now we're at the tape spot. I'm just going to pin that to the ground and we get our pin light to make sure there was no cooling in the back of the throat. We're all good there. So we would grab a piece of tape and split it. Put the non-split side on the bridge of the nose and wrapping each side around the tube. And then getting one more, putting it over the bridge. Okay. Right there. And then I would apply suction if needed. Okay, to be able to test our pH, I'm just going to grab a syringe, place it in here, and pull up about 20 to 30. Okay, good there. We're going to put that in there for pH testing. I'll take that from you now. Okay, and then I'll be sure to pin this to her gown. Take the cup. and I would be sure to perform oral hygiene. Okay, and then after this, I would come back in and I review the vital signs and all again, and the doctor's orders has told me to remove the NG tube. So I will begin by putting on a fresh pair of gloves. I'd have gloves on both hands, and then I would grab her towel again, and I would gently remove the tape, making sure not to remove any skin. It's going to be a sensitive area. Okay, dispose of that. Okay, and then I'm going to get you to take a big deep breath for me and exhale, and then take another big deep breath for me, but that time I want you to hold it and I'm going to pull it out, okay? Pull. Okay, it is very important to keep the tube in the towel due to all the secretions that may be on it. We're going to unglove and we're going to wipe her face to make sure nothing is on her face from the removal of the tube. Okay. Take that. And then I will perform oral hygiene again, of course, so to get that nasty taste out of your mouth. And then I'm going to lower you back down to a safe position. And of course, before performing the procedure, right before I started, I would be sure to get my patient to tuck their chin to their chest. Okay, now that you're back to a safe position, I'd make sure that your call light is within reach. Make sure you're all good and comfortable. And can I get you anything else before I leave? Okay, we're all good. And after doing the skill, I'll be sure to perform hand hygiene again.